Pneumonia is a serious respiratory infection that affects the lungs, causing inflammation and fluid buildup. The lungs are made up of tiny air sacs called alveoli, which are crucial for oxygen exchange. Pneumonia occurs when these air sacs become inflamed and fill with fluid, making it difficult for the lungs to function properly and for the body to get enough oxygen. This fluid can be pus, blood, or other fluids, leading to various complications such as difficulty breathing and reduced oxygen levels in the blood. Pneumonia can range in severity from mild to life-threatening, depending on the individual's overall health and the cause of the infection. It is particularly dangerous for infants, young children, older adults, and people with weakened immune systems, as they are more susceptible to severe symptoms and complications. Understanding the causes, symptoms, and treatment options for pneumonia is crucial for early detection and effective management, which can significantly improve outcomes. Pneumonia can be caused by bacteria, viruses, and fungi, each requiring different treatment approaches. The specific cause of pneumonia will determine the appropriate treatment, which may include antibiotics, antiviral medications, or antifungal drugs. Early diagnosis and treatment are essential for a positive outcome, helping to prevent complications and speed up recovery. Pneumonia can be classified into different types based on where and how the infection is acquired, as well as the specific pathogens involved. Community-acquired pneumonia, or CAP, is the most common type, acquired outside of healthcare settings. It often spreads through everyday interactions such as coughing or sneezing. Hospital-acquired pneumonia, or HAP, develops 48 hours or more after being admitted to a hospital. This type of pneumonia can be particularly severe due to the presence of more resistant bacteria. HAP is often caused by bacteria that are more resistant to antibiotics, making treatment more challenging and requiring stronger medications. Patients on ventilators are at higher risk of developing ventilator-associated pneumonia, or VAP. This occurs because the ventilator can introduce bacteria directly into the lungs. Aspiration pneumonia occurs when food, liquid, or vomit is accidentally inhaled into the lungs. This can happen during eating, drinking, or even vomiting. This can introduce bacteria from the mouth or throat into the lungs, leading to infection. It's particularly common in individuals with swallowing difficulties. Fungal pneumonia is less common but a serious concern for people with weakened immune systems. These individuals are more susceptible to infections due to their compromised health. Fungal pneumonia is caused by inhaling fungal spores present in the air, soil, or bird droppings. These spores can be found in various environments, making exposure relatively common. Viral pneumonia is often caused by viruses like influenza, RSV, or COVID-19. These viruses can spread rapidly, especially in crowded or enclosed spaces. While some viral pneumonias are mild, others can be severe and lead to complications. Severe cases may require intensive medical care and prolonged recovery periods. Viral pneumonia can also make the lungs more susceptible to secondary bacterial infections. These secondary infections can further complicate the patient's condition and treatment. Recognizing the symptoms of pneumonia is crucial for seeking timely medical attention. Common symptoms include a cough that may produce phlegm, fever, chills, and difficulty breathing. Chest pain, especially when breathing deeply or coughing, is another common symptom. Fatigue and a general feeling of malaise are also frequently reported. Some individuals may experience nausea, vomiting, confusion, and cyanosis. Infants with pneumonia may exhibit restlessness, fatigue, difficulty feeding, and rapid breathing. Older adults may present with atypical symptoms such as confusion and a lower than normal body temperature. Viral pneumonia often starts with mild symptoms like cough, fever, and shortness of breath, which may worsen over time. Diagnosing pneumonia involves a comprehensive evaluation including medical history, physical examination, and a variety of diagnostic tests to ensure accuracy. The doctor will ask about symptoms, medical history, and recent exposures to identify potential causes and risk factors. A physical exam is crucial for assessing the patient's condition, checking vital signs, and listening to the lungs for any abnormalities. The doctor will use a stethoscope to listen for abnormal lung sounds such as crackles or wheezing, which can indicate pneumonia. Chest X-rays are commonly used to diagnose pneumonia and assess the severity of the infection, revealing areas of inflammation or fluid in the lungs. In some cases, a CT scan may be ordered for more detailed images, providing a clearer view of the lungs and helping to identify complications. Sputum tests analyze mucus from the lungs to identify the specific bacteria or virus causing the pneumonia, guiding appropriate treatment. Blood tests may be ordered to check for signs of infection, measure oxygen levels, and assess the overall health of the patient. Pulse oximetry measures the oxygen level in the blood using a small sensor, which is crucial for monitoring respiratory function. Low oxygen levels can indicate that the lungs are not functioning properly and may require supplemental oxygen to support breathing and recovery. Treatment for pneumonia depends on the underlying cause, severity, and the individual's overall health. Bacterial pneumonia is typically treated with antibiotics. It's crucial to complete the full course of antibiotics as prescribed. Antiviral medications are used to treat specific viral pneumonias, such as those caused by influenza or COVID-19. These medications work by inhibiting viral replication. Not all viral pneumonias require antiviral medications. Antifungal medications are used to treat fungal pneumonia. Treatment for fungal pneumonia often requires a longer duration of therapy. Supportive care is essential for managing symptoms and promoting recovery. Supportive care measures include rest, fluids, over-the-counter medications, and oxygen therapy if needed. Hospitalization may be necessary for severe cases or those with underlying health conditions. Hospitalization allows for close monitoring and intensive treatment. Preventing pneumonia is always preferable to treating it. Vaccinations play a crucial role in prevention. The pneumococcal vaccine protects against a common cause of bacterial pneumonia. The influenza vaccine is recommended annually to prevent influenza virus infection. Good hygiene practices are essential for preventing the spread of germs. Washing hands frequently and avoiding close contact with sick individuals can help. Maintaining a healthy lifestyle can strengthen your immune system. Eating a balanced diet, getting regular exercise, and enough sleep are important. Avoiding smoking is crucial for lung health. Smoking damages the lungs' natural defenses, making them more susceptible to infections. Quitting smoking can significantly reduce your risk of developing pneumonia. Limiting alcohol consumption is also advisable as excessive alcohol use can weaken the immune system. Pneumonia is a serious respiratory infection that can affect anyone, regardless of age or health status, but poses a greater risk to vulnerable groups, such as the elderly and young children. Understanding the causes, symptoms, diagnosis, treatment, and prevention of pneumonia is essential for everyone. Timely medical attention is crucial if you suspect pneumonia in yourself or a loved one. Early diagnosis and treatment can significantly improve outcomes. By staying informed, practicing good hygiene, getting vaccinated, and making healthy lifestyle choices, such as regular exercise and a balanced diet, you can safeguard your respiratory health and that of your community effectively.